Do you know how a high deductible health plan works?
A lot of people don't, and so we're here today to tell you the ins and outs of a high deductible health plan and all the things that you should know before you offer one to your employees or before, as an individual, you sign up for one. I'm Shannon, this is Michael, we're with Healthcare Genius, and I'm going to start by asking Michael a couple of questions. So Michael, what exactly is a high deductible health plan? Can you kind of outline the structure for us?
Well, first of all, I think for most people, every plan is a high deductible health plan today. When you look at some of the deductibles that are out there, 5, 6, 7,000. But when we're talking about a high deductible health plan, we're really talking about a plan that allows you to contribute to a health savings account. And the government basically sets up rules. There's a minimum deductible that you have to offer. So you couldn't have a $500 deductible plan and have that qualify to contribute to a health savings account. The other thing that you can't have is, in most cases, first dollar coverage, meaning employees or their families have to actually hit a deductible before they see benefits from their health plan.
Now, just a reminder to kind of take a step back, what is a deductible?
Great point. So deductibles normally are your out-of-pocket expense. People are familiar with these, I think, more with their auto insurance or homeowners. So if you have auto insurance coverage, you might have a $1,000 deductible. So if you get in a wreck or something happens to you, you have to pay the first $1,000. And that's really the same thing with medical health insurance, is that those deductibles are designed that you have to pay those first. Now, what's different is that if you don't have a HSA high deductible health plan, a lot of employers have plans that have co-pays. So rather than you having to pay for the cost of an office visit, which could be $200 or $300 out of pocket, you have a copay which might be $20 or $30 or $40.
Now, if you have a high deductible health plan, but it still says there's some kind of copay, then how does that work?
Yeah, that's a confusing area, because a lot of plans will have you have to meet the deductible first. And then after you meet the deductible, there are co-pays. So we had this just happen with one of our clients where they thought they had a $30 copay because the way they read the document that explained the plan, there is a $30 copay. But in smaller print, it essentially says that you have to pay a $3,000 deductible first, and then after you've met that $3,000, then the $30 copay kicks in.
Right. So a lot of people might not even hit their deductible in a given year, which means that those costs, all their medical costs for the year, can actually be out of pocket, right?
That's right. And you know, one thing we always try to encourage our clients, don't be scared by a high deductible health plan. You know, if you don't use healthcare a lot and it's random for most people in a given year, these plans can work really well, because oftentimes they actually have a lesser out-of-pocket cost if you have something really bad than what some of the traditional plans that have office copays and prescription copays.
That's right. Not to mention, whatever your health insurance plan is, you're going to be paying a premium every single month, whether you use it or not, right?
That's right.
And for high deductible health plans, that premium is generally a lot lower than some of your other plans.
That's right. That's exactly right.
Now, my next question for you, and if you've seen some of our other videos, you might know the answer to this, but what is the number one biggest benefit of having a high deductible health plan?
The ability to contribute to a health savings account.
That's right. You might be familiar with an FSA, which is kind of similar to an HSA, but a health savings account is what it sounds like. It's intended to save. You can put money in and spend it on health expenses tax-free, which is so powerful. And so we encourage people to use it like a savings plan. You really can use those dollars at any time, and you could contribute as long as you have the plan for any year, any month, up until age 65, and then what happens?
So when you turn 65, as long as you are still working and you don't sign up for Medicare Part A or B, then you can continue to contribute to an HSA if you have a high deductible health plan. But the minute you sign up for Medicare, then you have to stop contributing. You can still use the money in the account, you just can't put new money into it.
That's right. So I mentioned you can use that on any health related things. What exactly does that include? Is it doctor's visits? Is it actually premiums? Or
when you're working, you can't take the money out of your HSA and use that to pay the premiums that you're paying from your employer out-of-pocket costs. But if you leave the company and you have COBRA, or if you're retired and you have Medicare costs, which in a lot of our videos we share with everyone what the cost of Medicare really is, you can take those HSA dollars and pay for those premiums, as well as out-of-pocket costs, prescription costs, dental, vision. All of those things are ways that you can use the money in your HSA, and it's tax-free. That's the best part. Truly is the best way to save for healthcare costs.
Absolutely. And if you haven't looked at the other videos that we're mentioning, just know that healthcare costs in retirement for the majority of Americans are an enormous problem. For many of us, it's actually the number one cost that we have in retirement. Now, if you need them in the meantime because of your high deductible health plan, you can still have access to that money again at any time. But if you can, save, save, save.
That's right. That's right. If you'll look down, there will be a link. We've created a report that will help you identify what healthcare costs might be for you. We forecast that. We also tie it to Social Security so you can see how it'll actually impact your Social Security check. We encourage you to use that with your employees and employer, and make sure that you have a good understanding of what healthcare costs are going to be when you retire.
Just to wrap up, Michael, is there anything that you would encourage people to do if they are interested in a high deductible health plan but are maybe scared of that really high deductible and paying out of pocket for that, first part until you hit that deductible?
Yeah, I think it's good just to look at the plans side by side, kind of understand what your risks are. If you go to the doctor a lot, if you have a lot of prescriptions, that's typically how we decide whether it's a good fit or not. Also, if you have scheduled surgeries, for a lot of people, if you know you're going to have a surgery in a given year, a high deductible health plan may actually be better than other traditional plans. If you know what's going to happen next year, how to plan for that. If it's the unexpected, then there are other coverages that can help protect you. We live in Colorado. There's a lot of people that ski, snowboard. So there are plans that can help protect you, pay you dollars to help offset what those deductibles would be on that high deductible health plan.
Mm-hmm. Like Michael said, check out our report so you know what your retirement healthcare costs would be. Feel free to watch our other videos on healthcare and retirement. And make sure you subscribe to our channel, click the notification bell so you know when we come out with new videos, and like our videos.